Welcome back. Now, the SOS Children's Village, Namibia, acknowledged the importance of community and family involvement in promoting child protection and supporting sustainable livelihoods. Now, with this, the organization aims to empower communities and families to take an active role in caring and protecting children. Additionally, SOS Namibia works to address gender-based violence, GBV, through partnerships and advocacy efforts. Joining us with more this morning is the Director of SOS Namibia, Julietta Ferreira. Good morning, ma'am, and thank you so much for making time to be here this morning.
Good morning, and thank you for having me.
Okay. Now, for those that might be watching, and perhaps also including myself, maybe talk to us about the mandate of the SOS Village in Namibia in terms of providing family-based care and also strengthening families in Namibia.
Okay. The mandate of SOS Children's Villages in Namibia is to strengthen family, to ensure that the families have the capacity to be able to protect, to provide quality child care, and in return, they are able to preserve their families and prevent family separation. And where that is not possible, that's when SOS Children's Villages come in and provide a loving home for children that have lost parental care. Yes.
Talking about that, perhaps, how do you focus on family strengthening to help prevent separation of children from their biological families?
Okay. Our aim is that we empower communities so that communities are able to empower families, so that families have the capacity to provide quality child care. And by ensuring that by families becoming empowered and strengthened, they are able to sustain their families and be able to provide, when we speak of child care, is being able to provide basic needs of a child so that the children don't end up being separated from their family, because when children are separated from their families, that's when they end up in residential childcare facilities like our SOS Children's Villages. And we say that residential childcare facilities should be the last resort.
Should be the last resort.
Yes.
Let's talk about how you achieve this balance between alternative childcare, because obviously there are some those without their parents. Obviously, maybe their parents have passed on, and hence there is no parental care, and also balancing with community family strengthening programs.
Okay. We believe, and also research has proven that children grow up better and become more resilient as adults when they grow up with their biological families and when they're part of their own communities. So organizations like SOS Children's Villages, what we do is we prioritize strengthening families, that is providing support to families in different forms. It can be through income generating activities or identifying trainings that families might need, or skills training, or also referring those families for social networks so that they are able to support their own families. We also look at strengthening structures in the communities like child protection structures in the communities, community-based organizations for them to be able to provide child protection and child care initiatives in their communities. And where that is not possible, we have, through our gatekeeping mechanisms, we ensure that children that end up in our alternative care programs, and that is in our villages, are those that really don't have anyone else to take care of them, or those that really need alternative care. That's when they come in, and then we also provide a holistic support with the aim of them becoming self-reliant adults, or for them to become self-reliant when they leave the care of SOS.
Oh, quite wonderful. Now, let's talk about the role. What role do youth employability and skills build programs play within the SOS Namibian mandate? Because one assumes, you basically make the young person to be resilient. It's unfortunate they're not growing up with their family. You build them. Do you also build them to be employable, for them to be able to adjust, once they leave the SOS village?
Yes. What happens is that as soon as a child comes in the care of SOS, we work on each and every child's development plan, individual development plan, to ensure that when they leave care, they are self-reliant. So that means that on an annual basis, those plans are reviewed. So as they grow, it turns into youth development plans. One of those needs that are identified, because these plans are drawn drawn by the youth themselves with support from our youth development officers. So one of the needs to be addressed is youth employability skills. Like we all know that in our country we have a high rate of youth unemployment. With other partners, with support from other partners like the Finnish Embassy, we secure funding for different activities. Let's say training in soft skills, interview techniques, CV writing, and other soft skills. And also we support them with skills training, vocational skills training, looking at children's different talents and abilities, those that are not too academically inclined but have talents in other areas. We take them through skills training, and also just to build their resilience so that after they've gone through this youth employability trainings, even if they are not able to secure employment, they are able to start their own businesses to be able to earn an income. And the Youth Employability Project also extends to other young people that are in need in the community, not only those in the SOS Alternative Care programs, but those in our family strengthening programs as well, and the entire community where there are young people that are in need, especially in the 3 regions where we operate.
Now we know that the Namibian SOS Village, Children's Village, has been operating in Namibia for quite some time now, many years. What would you say perhaps has been your greatest achievement that you have attained, let's say perhaps over the last decade?
Over the last decade, we've seen a number of children that have grown also in SOS, have become young adults, living care, that we've taken through different programs, ensured they had access to education, that have graduated from different universities, different vocational skills training, of which some have gained employment. Some young people that we've supported, especially through the Youth Employability Project, we've supported them with startup capitals and are running their successful businesses in different towns. We've also now, with the new child care reform agenda, we've contributed to deinstitutionalization, where we started from the year 2024, looking into assessing our children and young people and see those that are whose conditions at home or their families of origin have improved. We've reintegrated those young people so that they grow, or children, they grow up with their own families, ensuring that only those that are in need remain in our facilities. We've also, through our Youth Employability Project, we've also supported a number of young people. And also, in the past, we've also supported children through our clinic in Windhoek, providing health services, and also our early childhood development facilities. We are also now also embarking on the advocacy agenda to ensure that we advocate for children, especially for improved policies in terms of childcare and protection.
Let's talk about how the organization's family strengthening approach in communities like Upopo and Ondangwa specifically has helped caregivers and children to achieve long-term sustainability.
Specifically in Upopo, in Ondangwa, the family strengthening program started when we started with our operations in Ondangwa. That was in 2009. And during that period until now, we've assisted a number of families in Upopo, where we've provided support for education for young people. We have quite a number of young people that we've supported through education and completed their tertiary education, of which some studied in the areas of environmental health, engineering, and so on, and medicine. And then we've also supported families, especially those that also were affected by the COVID-19 pandemic. We set up capital for them to be able to start different livelihood projects, to be able to sustain their programs. We've also strengthened the child protection systems in Upopo, where we've provided training to the child protection committees for them to be able to attend to any child protection or related issues. We've also strengthened families by providing training such as parental skills training. Those are some of the initiatives that we've implemented in Upopo. And we also have a social center in Upopo that has been open to the community for any activities that the community intends to implement or organize. The social center is there that also plays as a, with different projects that the communities can make use of. We have resources for a bakery in Upopo, a sewing studio, and currently with the support from the German embassy, last year we completed the construction of an incubation center where we've expanded the bakery. There's also space for training for young people in case they want to make use of the place for trainings to build capacity of young people and for community meetings. And the social center is also open to other stakeholders in case they want to. Usually it also serves as an NID spot for National Immunization Days and also for different community support groups when they have their meetings.
When they have their meetings.
Yes.
Let's look, how would you assess, I know you talked a bit about it, but how would you assess the organization's success, especially in helping young people in Namibia transition to independence and also life, independent life and employment? Are there some success stories that you could assess or look at yourself and say SOS is proud with maybe a few cases that you have?
Yes, we have measures or indicators that we use to tell us whether we've been successful in implementing our programs. We look at the young people or children that have gone through our program. We look at their levels of self-esteem. We compare it to the time when they came into SOS and programs and after they left. We will look at their health conditions. We look at if they've completed, if they are successful with their education. A number of young people have completed their secondary education. Looking at if young people are able to complete their tertiary or vocational skills trainings. And for those that have completed skills training, vocational skills training, and those that we've supported with entrepreneurship skills, have they gained employment or have they been able to start their own businesses and also been able to employ other young people? We have quite a number of cases where we have some of our young people that have graduated that are currently teachers. Some of them are nurses in hospitals like the private hospital in Onanjokwe. We have one in Rhino Park Hospital, and we have some teachers in Windhoek, and some other young people working in other sectors as well. And then we have young people with successful businesses that have also been able to employ other young people. We have a few cases in Tsumeb, in Windhoek and Ondangwa as well.
Quite successful stories. Yes. Let's talk about the most pressing needs right now and challenges facing the SOS Children's Village in Namibia. What are those?
Okay. To start with, I'll look at the challenges facing our target group. There's been a lot of societal pressure on young people and children. Young people, we look at young people unemployment, and violence against children has been prominent of late. Issues of gender-based violence that directly affects children. Then there is issues of environmental pressures like issues of climate change that also directly affects children because it might cause family separation. And obviously a challenge that has been affecting most civil society organizations, not only in Namibia but beyond in sub-Saharan Africa, that is reduction in funding. Because of all these challenges that is being faced currently by SOS Children's Villages, there is a need for joint forces, working with different stakeholders, and also support from the community, support from corporate partners, for us to be able to address challenges faced by children and young people. Yes.
Okay. Unfortunately, we're running out of time. Briefly, perhaps, new initiatives that should SOS be focusing on 2025, 2026, besides the issue of fundraising as well as sustainability initiatives. What other initiatives are we looking at?
The current initiative, not new initiatives per se, that is something that we started implementing in 2025. That is the childcare reform agenda. To ensure that we align our programs with the guidelines on the UN guidelines on alternative care for children, that is looking at deinstitutionalization and implementing more community-based alternative care options. That is support for kinship care, support for foster care, and also ensuring that we only provide residential care for children that are really in need, and also advocate for that, because we believe that children grow up better when they are part of their community and when they grow up with their families, and ensuring that residential childcare should be as short as possible.
Short as possible.
Yes.
Well, Julietta Ferreira, thank you so much for making time to speak to us this morning.
Thank you too.